खबर ना 4 महिन्याचे गॅप आशिल्ले बिटवीन वेव्स आणि लेट जून किंवा जुलय आम्ही रायज इन केसेस एक्सपेक्ट करू शकतात. वेव अशी म्हणू जायना. आता तुम्ही पळयलें आसतलें की फाटल्या दिसांनी केजी मातश्यो वाडत आसात. काल 47 केसेस आशिल्ली, आज 50 आसात. रायज जरी कमी आसा, देर इज डेफिनेटली अ रायज. आणि whether it will be a fourth wave and all, it is too early to predict, but we can only say there is a rise of cases. आता the only thing significant हांव सांगू सोदता की this is not a new variant. आम्ही 68 सॅम्पल्स आमचे आजिलो जिनोमिक सिक्वेन्सिंग लॅबोरेटरीन टेस्ट केले आणि सगळे 68 जे आसा ते BA2 वेरियंट जे चालू आसा, दॅट इज ओमायक्रॉन, तेच वेरियंटाचे आसा. सो नवे कितें वेरियंट येवना. तुमकां खबर आसतलें ओरिजिनली द फर्स्ट वेव वॉज द कोवीड वायरस, ताजे नंतर मागीर डेल्टा वेरियंट आयलें आनी ताजे नंतर ओमायक्रॉन BA2 वेरियंट आसा आनी तोच वेरियंट सर्क्युलेशना आसा. सो इट इज नॉट अ न्यू. अजून पर्यंत तरी आमचे कडेन एविडन्स ना की म्युटेशन जालां आनी एक नवो वेरियंट आयला, बिकॉज ऑल 68 सॅम्पल्स आर ऑफ BA2. दुसरें हांव परत सांगू सोदता, लास्ट टायमी हांवें सांगिल्लें की वॅक्सिनेशन हें एकच उपाय आनी दुसरें गर्देच्या सिच्युएशना गेले जाल्यार मास्क घालपाचें. आतां तो वेळ आयला, ह्यो केजी मातश्यो रायज जाल्यात, जशें की आमी लास्ट टायम प्रेडिक्ट केल्लें, आनी हें सगळें लोकांनी पाळचें. रूल असो येवपाची गरज ना. आपले स्वताचे प्रोटेक्शना लागून खंय अशें सिच्युएशना गेलें जाल्यार मास्क घाल्लें बरें. आनी दुसरें वॅक्सिनेशन. आतां आमचे वॅक्सिनेशन स्टॅटिस्टिक्स बरी आसात. फर्स्ट जेन्ना पयलींची 2 वेव्स आशिल्ली ती डेंजरस आशिल्ली, हॉस्पिटलायजेशन जातालें, डेथ जातालें, तेन्ना लोकांनी वॅक्सिनेशन घेतलें आनी 2 डोजसूय घेतले. आतां आमचें वॅक्सिनेशन आतां आमी इतलें ट्राय करतात. आतां वॅक्सिनेशनाचे दीस आमी मंडे, वेनसडे, फ्रायडे दवरल्या सगळे PHCनी. आनी बेडेड PHC जे आसा, जी बेड्स आसा, ते रातचे 8 पसून आमी वॅक्सिनेशन करतात. चड लोक येवपा जाय अशें म्हणनात, पूण येत ताका आमी वायल ओपन करून वॅक्सिनेशन करतात. हर घर दस्तक तेंय आमी चालू केलां. आनी दुसरें म्हळ्यार ह्या आयतारा मातशें लक्षांत घेया की टिका उत्सव आसतलो. ताजेर डिटेल आमचो डॉक्टर बोरकर उलयतलो. बट मातशी म्हजी हें आसा की विनंती आसा की सगळे जाणांनी आतां बुस्टर डोज कोण घेवपा आशिल्ले, फ्रंटलायन वर्कर्स म्हळ्यार हेल्थ वर्कर्सच न्ही, पूण पोलीस आनी अदर दीस ऑफकोर्स डॉक्टर पंचायत आनी कोणें पयलीं 2 डोजस घेतल्यात तांणी परते 3rd डोज घेवचे. आनी 60ची वयर वर्सां आसा ती लोक मातशी वल्नरेबल आसतात, वीक आसतात, बिकॉज ऑफ दे आर सिनियर सिटीजन आनी एज जशें जाता इम्युनिटी मातशी कमी आसता. सो ह्या लोकांनी ज्या लोकांनी घेतलें ना ती मातशी म्हजी विनंती आसा की प्लीज हो डोज घेयात. आयतारा दवरला टिका उत्सव 5 तारीखेक. आमचे सेंटर्स आनी हॉस्पिटल्स खंय तुमकां बऱ्या लागीं पडटा, बऱ्या पडटा, थंय येवन वॅक्सिनेशन घेवपाचें. आतां फुडलें अबाउट द प्रेझेंट स्टेटस ऑफ कोवीड आनी आमचे एनालिसीस डॉक्टर उत्कर्ष प्रेझेंट करतलो.
डायरेक्टर ऑलरेडी सांगला की आयज केसीस 50 केसेस जाता, पॉझिटिव्ह केसीस, अँड दिस इज आउट ऑफ 782 सॅम्पल्स टेस्टेड with a positivity rate of 6.39. Now if we see last 3 days, our positivity rate is going above 5%. And if we check our weekly cases, we dipped to almost around 13 cases only for entire week. This was on week 15th of this year. And now if we see in this current week, for last 5 days we have got 176 cases. So if we see this, weekly rise is definitely there. Although it is a small rise, but then it is some initial rise which is saying whether this will convert into a major wave or not, we really don't know at this point of time. What we can do at this point of time is only, as director has said, COVID appropriate behavior, especially when it comes to above 60 comorbid condition people and children, as well as vaccination. Whoever is not taken, they have to come forward and take it as immediately as possible. Even variant data, madam has already said, whatever 68 samples we have tested at North Goa district hospitals, all have shown as Omicron BA2, which is not new variant. And if we even see our admission rate on a daily basis, even admission rate is shown in our media bulletin, it is almost close to 0. We had one admission few days back in GMC, and last few days we don't have any admissions. see our death rate is again 0 right now. Definitely there is a rise. So what we will right now tell or ask public to do is take precautions for their own good and take vaccination.
I have a question for you. If you're finished, I can ask you one question. My uncle is 75 years old and he is comorbid. He's almost on the bed, but he has not taken a single dose because he says that doctors advise him not to take any dose. If he takes the dose, he's at least is what doctor has told him. So what do you advise, madam?
Yeah, see, if your doctor has said that he shouldn't take the dose, we from our side would say please don't take, because we always say this is voluntary, it is not compulsory. From that point of view, whenever somebody is in doubt, we advise them, you take the opinion of your physician and go accordingly. But then what I would say further is that ताका जर protect करतलो, there is another way to do that. All the people around him should get protected. समजा तुमच्या घरात बाकीचे लोक आसात, if they get vaccinated, we create an aura in around him so that he is protected. So this is the way it should go. Yeah.
I will complete this because Dr. Bolkar has to talk about the vaccination. आम्ही किती
त्याच्यानंतर मग तुमचे questions असतात सांगा. Yeah. So let me talk something about vaccination. As such, Madam has very nicely comprehended everything. She has told you what is the picture, why is the need for vaccination, and what is the way forward. I will only talk about immunization. There is something very interesting about our immunization. Puno to interest we have told n number of times. The thing is that आम्ही पहिलो dose जो असा for 18 and above 13 लाख लोकांक dose दिलो आम्ही. We have given 13 lakh doses in the state of Goa. Second dose आम्ही approximately 12 लाख लोकांक दिलो. म्हणजे in all 25 lakh doses have been administered as first dose आणि second dose. आता हे असे लोक ह्यांच्यातले बरेच लोक they have completed their 9 months and they are due for their third dose. And you will be surprised to know that only 54,000 people have taken the precautionary dose. So खंय आमचे 12 लाख लोक जेणी second dose घेतला, all are not due for their precautionary dose. पण हितूंतले जवळजवळ 1,80,000 लोक असे आसात who are due in the government services. आणि government services कोण आसात? Healthcare workers, frontline workers and people above 60 ज्यांका free dose असावो आणि ह्या लोकांनी अवश्य येऊन घेऊ जाय. These are the people who are at most risk. म्हणून गव्हर्नमेंटान तांकां फ्री दवरला आणि गव्हर्नमेंट सीव्हीसीनी दवरला. हेल्थकेअर वर्कर्स आय रिपीट, फ्रंटलाइन वर्कर्स एंड पीपल अबाव 60 दीज आर द पीपल हू आर एट द मोस्ट रिस्क. तांकां फ्री दवरला आणि अशे 1,80,000 लोक ड्यू आसा एज ऑफ टुडे जेणी येवन हो डोस घेवंक जाय. बट दीज पीपल फॉर सम रिजन ऑर द अदर have not come up for vaccination. The reasons that we see is that cases nashilyo, deaths nashile, hospitalization nashile, paper are news nashili. But as Dr. Utkarsh has said, gradually this news is coming up. जे आम्ही 0 आशिल्ले end of the third wave, आता आम्ही 50 पर्यंत पावले. This is a significant number. म्हाका जर as a immunization officer म्हणून जर तुम्ही विचारशात, this is a significant number. कांयच नाशिल्ले थंय 50 जावप. Initially from 0 to 10 जावप difficult. 10 चे 20 जावप comparatively easy. 20 चे 50 जावप is comparatively much easy. आणि 50 चे 500 जावप is much easier. So let us not wait till it becomes 500 and 5,000. Let us take the steps right today. आणि जसे मॅडमीन सांगले, we have to do COVID appropriate behavior. मास्क घालप, हात तोंड व्यवस्थित धुवप, सोशल डिस्टन्सिंग पाळप, गर्दीची ठिकाणं अवॉइड करप. दिस इज कोविड अप्रोप्रिएट बिहेवियर. अँड लास्टली वॉट वी हॅव इन आवर हँड्स विच इज व्हेरी डेफिनेटिव्ह इज वॅक्सिनेशन. इतल्या दारापर्यंत वॅक्सिनेशन हाडला. अगेन मॅडम हॅज ऑलरेडी सेड दॅट आम्ही जो एकूच दीस वॅक्सिनेशन करताले, द रिजन बिहायंड दॅट इज लोक खूप कमी येताले, आमची वेस्टेज खूप जाताली म्हणून आम्ही फक्त दर ब्रेस्तारा दवरलेले. ते वॅक्सिन आता अंडर हर ऑब्झर्वेशन्स आम्ही आता आठवड्यात 3दा केला. सोमार, बुधवार, शुक्रार. 1 thing. So from 1 we have gone to 3. Second thing is that असे दिसून आयले की कदाचित आमकां अशें आमी अशें म्हटलें की 4 पर्यंत दवरतकच बऱ्याच लोकांना येवपाक मेळना काय आमच्या सेंटराचेर. सो वी हॅव इन्क्रीज अनदर 4 hours. सो अप टू 8 o'clock in the night also we will be giving the vaccine. म्हणजे आम्ही टायमिंग वाडयला. थर्ड थिंग इज दॅट आम्ही आता घर घर दस्तक म्हणून दवरला. अँड आवर अपील टू एवरीबडी इज सगळ्याच जाग्यांचेर आमी येतले अशें चिंतू नाकात. बट वी आर रेडी टू कम. आमकां फक्त इंटिमेशन दिया की अमकी सोसायटी आसा, अमकी एक कॉलनी आसा जंय 10 किंवा मोर पीपल आसा. वी डोंट इवन एक्सपेक्ट 100. 10 किंवा 10च्या वयर अशे जर लोक आसा अशें जर आमकां जर कोणी जर सांगलें इन ऑल द हेल्थ सेंटर्स, वी हॅव मेड टीम्स इन ऑल हेल्थ सेंटर्स सो दॅट वी वील गो देर अँड वॅक्सिनेट दोज पीपल. म्हणजे घराघरांनी हाका घर घर दस्तक म्हणटात. हो कॅम्पेन जो आसा तो जून आनी जुलय दोन्ही विकांनी चलतलो. अँड स्टील टू गिव वन मोर पुश टू दॅट, इन दीस संडे दॅट इज 5th of June 2022 आम्ही टिका उत्सव दवरला. ह्या टिका उत्सवान अशी अपेक्षा आसा जशें आमी लास्ट टायम टिका उत्सव दवरलेलो, वॉट वी फावंड इज सगळे जे आमचे लोकल रिप्रेझेंटेटिव्स आशिल्ले, पंचायत मेंबर्स, म्युनिसिपालिटी आनी कोण ते सगळ्यांनी त्रास घेतलो आनी लोकांक घरांतल्यान भायर काडले. आणि वी वॅक्सिनेटेड. द नंबर वॉज एज हाय एज 18 to 20,000 पर डे. म्हणजे इतली आमची ॲक्च्युली कॅपॅसिटी आसा 18,000 ते 20,000 लोकांक एका दिसा वॅक्सिनेट करपाची. वी आर रेडी फ्रॉम आवर सायड. आता लोकप्रतिनिधी जे आमचे आसात, मिडिया जी आमची आसा, तुम्ही कसो अवेअरनेस करतात, कशे लोक भायर सरतात, हेजेर आमचो सक्सेस आसा. आय अगेन वॉन्ट टू टेल, विथ 1 dose efficacy is 50 to 60%. With 2 doses it is 60 to 70%. which is not enough to protect us. जेन्ना आमी 3 डोस घेतले तेन्नाच 90% एंड अबाव आमची इम्युनिटी प्रतिकार शक्ती मेळटली अँड दॅट वील प्रोटेक्ट अस फ्रॉम कोविड. लोक तरेतरेची कारणां सांगतात, म्हाका कोविड जावन गेलो, म्हाका कोविड अजूनही जावना, आतां कोविडूच ना, एडमिशन्स काय ना, डेथ काय ना, वाय शूड आय हॅव काय म्हणून विशाची परीक्षा पळयतात. आय रिक्वेस्ट ईच अँड एव्हरी वन, प्लीज डोंट वेट. स्वता घेयात आणि तुमच्या लागीं जे कोण आसात तांकांय मातशें बाबा पुता करात. Bring them to our vaccination centers. Please get vaccinated. Be safe. Be protected.
एक प्रश्न असतालो की वॅक्सिनेशन घेऊनही कोविड कशें जालें. वॅक्सिनेशन आतां तुमकां खबर आसा की हॉस्पिटलायझेशन रेट इतले कमी आसा, डेथ्स आर प्रॅक्टिकली नील. दीज आर द रिझल्ट्स ऑफ वॅक्सिनेशन. जरी कोविड जालें तें लॅव आसता आनी एक्स्ट्रीम हाजेर वचना. आता डॉक्टर बोरकरान सांगलां की बुस्टर डोस घेवचो. बुस्टर डोज वी आर गिविंग फॉर पीपल हू आर मोर वल्नरेबल, जे 60 वर्सां वयर आसा, फ्रंटलायन वर्कर्स ज्यांचे संपर्क चड आसता विथ पेशंट, असले हांवें सगळे जाणांनी म्हजी विनंती आसा की 5 तारखे येवपाचें आनी एक बरोबर बुस्टर घेवपाचो. बिकॉज इम्युनिटी बिल्डअप जावपाक वेळ लागता, 2-3 आठवडे तरी वतले आनी तोपर्यंत आमची केजी वाडत आसत. सो 5 तारखेक याद दवरात. जशें की तुम्ही पल्स पोलिओ आनी हें तें लेट अस गो इनटू मिशन मोड आनी 5 तारखेक ज्या लोकांनी घेतले ना ती सगळी सेंटराचेर येयात आनी वॅक्सिनेशन घेयात.
मॅडम आनी एक गजाल तुमी नदरेन हाडून दिवंक सोदता की बरेच लोक इवन जोर येयल्या वचना टेस्ट करपाक. दे से इट्स नाव इट हॅज बिकम लायक दीस फ्लू एंड दे डोंट गो फॉर द दीस टेस्ट. सो ताका इफ दे गो, इफ ऑल दीस पीपल गो, द केसेस मे बी मोर. Because I have seen some of my relatives, they have got this and they have not gone for the.
You are right. They should go for testing.
So is it safe not to go for check-up?
नाही सी प्रत्येका एक सोशल रिस्पॉन्सिबिलिटी आसता. आता तुवें जशें म्हळें तुगेर एक 75 वर्साचो बापूय आसा तुमचो. इफ वन ऑफ युअर फॅमिली मेंबर्स गेट्स फिवर आनी तो टेस्ट करपाक गेलो ना जाल्यार कितें जातलें म्हाका सांगात. दीस इज द थिंग. सो सोशल रिस्पॉन्सिबिलिटी आसता प्रत्येका दीस यूज.
घर घर दस्तक जी मोहीम चालू आहे त्याला कसा प्रतिसाद मिळाला, किती लोकांचं वॅक्सिनेशन झालं आहे?
Actually, that मोहीम has started from first. Government of India has said from June and July या 2 महिन्यात ती करायची आपल्याला. But we have started it 1 week prior. But because of the preparations and everything, I think the response is not as good as expected. Because what is happening with Har Ghar Dastak is, these are the people who have not opted for vaccination earlier, and even when we go to their places they are still reluctant. But I believe one will add to one. जर एकट्याने घेतला असेल दुसरा घ्यायला येणार. दुसऱ्याने घेतला तिसरा घ्यायला येणार. That will actually prompt them to take the vaccine. But as of now, frankly speaking, काल जवळजवळ 700 लोकांना टोटल वॅक्सिनेशन झालं. परवा 650. This figure is not satisfying. We have to vaccinate around 2,000 people per day if we want to have it as per our statistics. 2,000 लोकांनी घेतली पाहिजे. And if you see that, it is only 1/3. So the response is poor. But पाणी शेवटी घोड्याने पिलं पाहिजे. We are going house to house. ह्याच्या ऊपर काय करता येईल? Let us know. And we will take up the call.
Doctor, there are some misconceptions. There are some misconceptions among the people because some people say that we get ourselves vaccinated, blood clotting takes place. This type of misconceptions are there. So how you have to work against this?
At least in Goa,
Schools are reopening on 6th. So what is your advice to parents for those school-going children? Because if you are talking about everybody, school children will be at risk,
So 15 to 18 and 12 to 14 we have this vaccination. So when the schools reopen, definitely we'll be going to schools. Dr. Bhutko?
Yeah.
Statistics.
Let me tell you.
Statistics.
Yeah, I will tell you the statistics and I will answer your question.
Yes.
Schools, it is a captivated cohort. Schoolan आम्ही जसे एकदा गेले की आमकां ते सगळे भुरगे मेळटात. So our coverage in schools is actually good. From 15 to 17 years, we have covered 93% first dose, and second dose is around 80%. This is a good percentage. And from 12 to 14, it is 65% first dose and 47% second dose. Now the question is, why the remaining people are there? Because when we started the campaign, there was exams, so people were little reluctant not to take the dose. And then immediately after the exam, there were holidays. So, but now, like 3 days prior, in Ponda Sub-District Hospital, Ponda Primary Health Center, suddenly 180 children came. And we were flooded. So, जर हो impetus जर असंच जर उरलो, I am not much worried about vaccinating the children because we will get them. Only thing is that आमकां स्कूलान बरो response दिवपाक जाय, which they have already given. School start जाली की we should be able to cover this.
What I want to know one thing is that is it advisable, since you all are advising everybody, is it advisable for children to go to school at this moment?
केसेस वाढत
Cases
असतात, शाळा
वाढत
सुरू
असतात.
करणं आता
Is it advisable to-
धोकादायक वाटतं का तुम्हाला?
You tell me, supposing we say आता cases वाढतात, have we stopped going to market? Have we stopped going to work? Have we stopped going for picnics? Have we stopped going for vacations? We are doing everything. It only comes to school, then we raise a question. My request is, सगळ्या भुरग्यांनी जर वॅक्सिनेशन जर घेतलें, घराकडे पेरेंट्सांनी जर घेतलेलें आसा, there is a comfortable, safe zone around them. We have to see, as you must be remembering, आमच्या प्रायम मिनिस्टरान म्हटलें, जान भी और जहां भी. सगळेच जर घरा रावले, संसार चलचोच ना फुडें. You understand? So तें करपा खातीर आमकां कितें प्रोटेक्शन घेवचें पडटलें तें आमकां पळोवचें पडटलें, and then we have to go ahead.
So will there be compulsory mask for students in schools and for government establishments? Will there be compulsory mask?
See, nothing, I said in the very beginning, nothing should be compulsory. It should be a social responsibility. And we should be wearing this mask, which I also have in my this. Just because you may not be audible, I have removed the mask right now.
Okay,
Madam,
what
the
would be-
problem is that unless and until we make such compulsory,
No, see.
people don't. They say it's I will not wear because it's not compulsory. It's
No,
just
no,
optional.
no. I would say through your this only now that the media is present. It is much advisable to wear a mask.
Doctor, what would be your advice to government officials or even to the ministers or to the concerned government, because huge functions are organized, everybody is there, we also go there. Whether it is followed or whether it is not
See,
followed, everybody knows.
it is a voluntary thing on your part, whether we go or we don't go. That is what I would like to say. Because we are all adults, whether we choose to go or we don't
So,
choose
but it is
to go.
advisable, you mean to say, for
Yes,
everybody. Right
yes.
from the minister to everybody.
Yes, if all are people, no?
Yeah, that's right.
See, what Madam wants to tell you all is, depending upon the positivity, the guidelines will keep changing. Dr. Utkarsh may tell on
Yes.
this.
See, even if you know all these waves, expert committee was taking various decisions, and then the government memorandum or the orders were coming out. So now there is some rising. Okay, probably an expert committee will be called up because expert committee is under chairmanship of our Dean Governmental College. So probably all experts will sit together. All experts will give their opinion, and then we will reach to some, if at all required, some guidelines will come. But as of now, we will move with the guidelines which are there in the state and in the country.
And if you ask me, don't wait for the guidelines to come. As madam is saying, जीव जर आपल्याला वाढवपा जाय जाल्यार गायडलायन येवना म्हणून हांव गेल्लो आनी म्हाका कोवीड जालो. Can we say that? So it is best that don't wait for the guidelines. Use your logic. Get vaccinated. Get away from the people in crowd. Wear a mask. See, all these things which we are telling doesn't cost you anything. जर पैसे पडनात आणि स्टील आमचो जीव जर वाचता विशाची परीक्षा कित्याक करप? इट इज सिंपल लॉजिक आय बिलीव.
डॉक्टर लास्ट टाइम जेन्ना एक्सपर्ट कमिटीन आपले चेंज केले की पॉझिटिव्ह रेट पळय नाशिल्ले ते एडमिशन रेट पळयता.
True.
सो द सेम थिंग दे
See,
should apply
till the time Omicron continues, I think our admission rate will be low.
ओके.
Death rate again will be in some control if it is Omicron only. Okay. But then definitely there is some rise which is seen. So cases will be there. Might be these cases will go on increasing, but we don't know till where. So that's why all this is told that we need to take some, it is advised to continue with COVID appropriate behavior. Take appropriate measures right now. If at all cases keep rising, whatever administrative or by order something which has to come will come on that own time.
Doctor, already cases is rise. Two quarter. What is exactly? यात mutation असेल की नाही?
No, right now there is no mutation because as we have already told, this was the last test was out day before yesterday, where 25 samples were tested in our North Goa District Hospital, and all 25 have come as Omicron BA2. So based on this scientific evidence, we can say that right now circulating strain or variant is BA2 in Goa, which had a wave in past.
How many patients are आता जर दोन्ही variant यायला झाल्या with these doses which we have taken, how safe we are?
See, some of the proteins in that virus is common to all variants, and these common proteins ते vaccine तयार केल्ले असता. So I cannot of course predict कसलो variant येतलो आणि ताची proteins किती असतले, but definitely some protection is there.
Immunity is shared by some variants. Now admission you were asking. I think somewhere around 4 or 5 days back we had shown one admission in GMC. There are right now 3 people who are admitted in GMC. One is for COVID-19 and other 2 are admitted because they have been found incidentally positive. They are admitted for something else, but they are found to be positive for COVID-19. So we can fairly say that out of 3, only 1 person is admitted for COVID-19.
And sir, any suspected cases of monkeypox?
Monkeypox actually is completely a different topic.
Since he has asked the question, we will answer briefly because guidelines are all this.
Monkeypox, we have received advisory and detailed guidelines from Government of India, and as of today, we don't have any cases in India and neither in Goa. Advisory is sent to all doctors in the state, whether it is in government setup or whether it is in private setup, so that they are aware. They can anytime they see some cases with fever with rash. And especially when if such cases have a history of travel from all these countries where monkeypox cases are found, then they should keep some suspiciousness in mind and they should send samples to Directorate of Health Services to NIB Pune, and we should send test such samples. So that advisory is gone to all doctors in the state. And other things are there is a possibility of even home isolation in the guidelines. Even if tomorrow we get some suspect or a confirmed case, there is a possibility of a home isolation like what we do in even COVID-19. And there is, if at all patient needs any management or any critical management, patient will be shifted to our hospital isolation, and then the patient will be managed.
So for any suspected cases?
In fact, we had sent one sample which was more of a chickenpox, just to check our, sending of a sample to NIB Pune. It came as a negative. But then strong suspect we have not got any. Right?
Any person who also has chickenpox or that hand, foot and mouth disease, the name is very long, but basically it is because of hygiene and it's spreading. kindergarten and all. The same kind of rash comes. So these kind of these are that if they fit that they have had history of travel or contact with this, these samples we will be sending to NIV Pune. So we are vigilant.
डॉक्टर आता जो कितें म्युटेशन बीन तुका खंयसर आयकपाक गेला खंयच्या स्टेटीनी बीन जाला अशें काय सगळ्याकूच
Right now, even whatever Maharashtra, we came to know even only from media. However, it is only Omicron. Till the time Omicron doesn't change completely and comes out completely with some new infectiousness, we are still fine. The cases will be something mild. Number of cases will be there, but then cases will be mostly mild.
So, since the new variant is known that since long, can we say this is the end of the pandemic?
It's difficult to say because we are still getting cases. Definitely, we are still getting cases. End of a pandemic will be decided by World Health Organization, okay, because they see a major picture. Pandemic is for whole of the world. It is not just for Goa, right? We can only talk about waves staying in Goa, but pandemic decisions will be taken by World Health Organization.
I think we should focus more on how to control our infection spread now and how to protect ourselves. Whether it will be controlled, this will happen, mutation will happen, only time will tell. As of now, the time says protect yourself, get yourself vaccinated. Yeah?
Thank you.
Thank you so